Public Health England applies emergency measures to protect those at highest risk after manufacturing problems hit supply. Public Health England has announced emergency measures because of a global shortage of the hepatitis B vaccine. The prioritization guidance has been put in place to protect those at highest immediate risk from the shortage, which has been caused by problems in the manufacturing process. Hepatitis B jab to be added to immunizations of babies born in UK. Read more. The measures, which mean that only the most vulnerable will receive the vaccine while others will have to wait, are expected to continue until 2018. Hepatitis B is an infection of the liver, which is spread through contact with infected blood and body fluids. The risk of catching hepatitis B in the UK is very low, but the vaccine is usually offered to individuals who are at specific risk of being exposed to body fluids from an infected person. This includes babies born to mothers who are infected with hepatitis B, the sexual partners of infected individuals, and a range of other groups such as men who have sex with men, healthcare workers and intravenous drug users. It is also recommended for anyone undertaking activities such as getting a tattoo overseas. The recently announced addition of hepatitis B protection to the routine childhood immunization program at 2, 3 and 4 months will go ahead as the combined vaccine is not affected by the shortage. A PHE spokeswoman said, "The manufacturers are getting more stock in, but there has been an issue for a while, so that's why we have put this prioritization guidance into place. We know that the hepatitis B vaccine takes a long time and is quite difficult to manufacture. We will make sure those who really need the vaccine will get it, and those who are less at risk should get it at a later date. It's important to note that we are a very low-risk country for hepatitis B, and the most at-risk group are babies. The most common route of transmission is when a baby is born to a mother who has it, but the pediatric vaccine is not affected by the shortage. Individuals can reduce their risk of contracting hepatitis B by avoiding unprotected sex and injecting drugs, by not sharing needles when injecting, by avoiding having tattoos, piercings or acupuncture when overseas, and by avoiding medical or dental care in high-prevalence countries." The spokeswoman said, "We think there will be shortages until early 2018, so we are urging people to make sure they are taking the right precautions while the shortage is ongoing."
Emergency measures have been introduced until 2018 to protect the most vulnerable, but some patients could have treatment delayed. A global shortage of the hepatitis B vaccine has been declared by Public Health England, PHE, because of manufacturing problems. Emergency measures have been put in place to protect those at the highest immediate risk and are expected to continue until 2018, the body said. Doctors will assess which patients are the most in need and advise whether some treatment can be delayed. PHE said the risk of catching hepatitis B in the UK remains very low. People who have unprotected sex, inject drugs or have dental and medical care in high-risk countries are most vulnerable. Hepatitis B is an infection of the liver, spread through blood and bodily fluids. NHS Choices warns that it often doesn't cause any obvious symptoms and typically passes in a few months without treatment. Children can get serious liver damage if the infection persists for years. Symptoms include tiredness, fever, loss of appetite, jaundice and feeling and being sick. PHE confirmed that children aged 2, 3 and 4 months old will still get the vaccine as part of the routine childhood immunization schedule, which protects them against 5 other diseases. It pointed travelers to the Travel Health Pro website, which describes hepatitis B as one of the most prevalent blood-borne viruses worldwide and a major cause of chronic liver disease and liver cancer. The infection is most prevalent in East Asia and Sub-Saharan Africa, where between 5 to 10% of adults have it.
Mexico confirms lack of hepatitis B vaccines. Mexico, August 7, Prensa Latina, the Mexico's Ministry of Health, SSA, has confirmed today that there is a shortage of hepatitis B vaccine due to global production problem. SSA will buy 1 million doses, which is a third of what is needed to aid children with no social security, according to the government. Such a vaccine will not be available till December, when an Indian lab, the only one that accepted the commitment, passes the quality and safety tests of the Federal Commission for Protection Against Sanitary Risks. Louise Girard-Duran, director of the National Center for Childhood and Adolescent Health, accepted that there are problems of shortages with some biological preparations, mainly in areas far from the nation. He ruled out red outbreaks or an emergency situation, even though La Journée, a newspaper, said that it is pending the purchase of 4 million doses to combat diphtheria, whooping cough and tetanus, which is applied for 4-year-old children.